They are so ripped.
Look at Milan. No, check it out.
I hate your wasn't good because it definitely didn't roll. Okay, so measuring the knee is not going to be rocket science, right? So we're going to bisect the segments. We're going to have the stationary arm proximal, the moving arm distal. The stationary arm is going to be bisecting the femur. We're going to be using that greater trochanter again as our alignment. And then we're going to go to the lateral malleolus. We have some pretty convenient landmarks there. Jenna, you are just a tidgy-bidgy there. A little So you guys need to hone up on your medical terminology.
Tidgy-pidgy?
Yeah. So we're at 3 degrees of hyperextension. Now the knee, so I'm doing 0 to 134. I'm not 0. I'm getting negative something. 3 to 134. Now the knee has quite a bit of translation along with the rotation, so the axis of the knee changes a lot. So please do not worry about the axis for knee goniometry. Okay? Because there's so much translation of the tibia when we go into flexion. So I want to stabilize the pelvis with this leg. Can you move your pillow so that you're more comfortable? Okay, and hold the leg right here. Don't switch your there. There you go. It ended up being more complicated than it was. And I screwed up. So she needs to have her leg coming off. So I'm going to have you sit up again.
Can I just pull myself?
No! So scooch it a little bit more this way. Okay, now I'll go down. There you go. You guys didn't see that because I would have done it right the first time. Okay, hold it there. There you go. So there's 2 components to the hip flexor muscle length test. One is the iliopsoas and the other one is rectus femoris. For iliopsoas, it crosses the hip. So we're going to measure hip motion. Okay? If the length of the iliopsoas is normal, the upper leg will be on the table. Okay? So we're measuring the absence of hip extension. So if she had a tight iliopsoas, her leg would be like this. We would measure the hip flexion and we would document as a negative number because she's unable to get to that neutral position. Okay? Another way that people document the iliopsoas, by the way, this test actually has a special name and it's the Thomas test. Okay? So for the Thomas test, you can also measure the distance from the posterior thigh to the table in centimeters, is the other way to document that. Or it's a negative number because you're documenting the lack of extension. Okay? The other component to it is the rectus femoris. And so now the rectus femoris is a 2-joint muscle. We've maximally lengthened it at the hip. So what joint are we going to measure? Knee. Okay? A normal test or an unremarkable test is if her knee was hanging straight down and if she was at 90 degrees. She has a tight rectus femoris. Thank you, Jenna, for making her life a little bit more interesting. So here, so remember this is a passive test because it's a muscle length test, right? And so she is at 10, 20, 30, 40, 52 degrees of flexion. Right? Test is for the knee to be flexed to 90, and then you measure the hip position. Well, we know from her Thomas test results, her iliopsoas actually isn't tight. It's her rectus femoris. So to do the prone test with the knee flexed to 90, you're not isolating iliopsoas. So in someone who, as I lifted her leg to put her in the standard position and I saw this happen, I would not do that in the standard test. Okay? So then I would simply measure her hip position with the knee not bent. Because if her iliopsoas was tight, that would show up now, right? And some of you are going to be tight. And so can you flex your hip for me on this side?
Like this?
No.
Oh, like this.
There you go, yeah. So she might be on the table like this. So then I would line up my goni again and measure that hip flexion. And again, it would be a negative number because I'm measuring her lack of extension. Okay, go ahead and relax. Now is start here and then flex the knee until the hip starts to come up. That's the standard way to start the test. Well, for her hip has already come up. Okay, so how I would suggest that you do it is start here, and when I start to feel her right there, then I'm going to measure that. Are you laughing? Okay. 10, 20, 30, 36 degrees. So I would do the prone rectus femoris length test, knee flexion, 36 degrees. So Maddie, you had asked the question about if you had to say what joint you were measuring before. You do for the prone test, you don't for the Thomas test, because the Thomas test is a thing. Okay?
We're going to have to do the prone one on the